Hi, my name is Linda Taylor. I'm a technical product manager with Digital Square at Path, and I manage global goods engagement on the Digital Public Infrastructure for Climate and Health project. So climate change is directly affecting people and health systems around the world. Rising temperatures, shifting rainfall patterns, and more frequent extreme weather events are contributing to the spread of climate-sensitive diseases, disrupting health service delivery, and putting lives at risk, especially in the most vulnerable communities. Addressing these urgent threats requires new ways to link climate and health data to guide action. And that is precisely why this annex, which is complementary to Path's Global Goods Guidebook, was created to respond to the increasing need to identify and share digital tools that integrate climate and weather data for health systems, helping countries to make informed predictive models, anticipate risks, and respond more effectively. Before we dig into the annex itself, let me give you a brief framing of this work for context. Path works with ministries of health to align adaptable, interoperable digital technologies with local health needs. We bring partners together to improve how the global community designs, uses, and pays for digital health tools and approaches. Path provides a mechanism to foster alignment and coordination amongst investors, implementers, and innovators to reinforce one another in hearing and supporting country priorities. Countries around the world are transforming their health systems, leveraging digital tools and the data that they produce as they work towards universal health coverage. Achieving health equity is increasingly reliant on ensuring that everyone, everywhere, has access to and benefits from health services that are enhanced by appropriate digital technologies. Digital Square at Path, with funding from Wellcome and the Rockefeller Foundation, is supporting the World Health Organization, World Meteorological Organization's joint program on climate and health. This is a partnership that bridges public health and climate science by combining expertise, data, and action to help governments and partners build stronger, more resilient health systems. This annex is a part of that effort. WMO's global network, built through decades of cooperation amongst its member states, enables the collection, processing, and sharing of vital climate data and forecasts. But data must be translated into actionable information for health professionals, whether they're managing a disease surveillance system, designing an early warning tool, or writing a national adaptation plan. Collaboration between WHO and WMO is providing a high-level mechanism to enable climate-informed health system strengthening. So why this annex and why now? Well, first, there's a global recognition that health systems must become climate responsive. At the World Health Assembly in 2024 and 2025, member states called for action to integrate climate and health data into national systems. Similarly, the WHMO-WMO Joint Programme on Climate and Health has been emphasizing the importance of connecting climate science with public health action. Second, we've seen that digital health tools already play a huge role in health systems for managing patient records, supply chains, and disease surveillance. But until recently, few of these tools were designed with climate resilience in mind, and that's the gap that this annex helps to fill. Third, whilst DPI has not historically been designed with climate resilience in mind, it plays a vital role in building climate resilient systems. Service delivery components such as telemedicine, supply chain management, and patient record systems actively support health systems to handle climate challenges better. Furthermore, global goods can strengthen DPI by providing open, interoperable tools and data systems that integrate climate information into health decision-making. In short, the Annex was created to identify practical, open-source, scalable solutions that foster integrated climate health data. Let me quickly summarize what you'll find in this annex. It showcases 3 newly approved global goods, free open source digital tools that integrate climate and health data. It also highlights a set of emerging innovations that are not yet fully scaled, but that are already showing strong potential. It describes each tool in terms of its use, functionality, technical standards that it supports, the community support, and impact. And most importantly, the annex is action-oriented. It helps governments, implementers, and funders identify solutions they can adopt and adapt for their own context. The annex was built through a highly collaborative process. First, we developed a climate and health maturity model that was informed by a diverse group of climate and digital health subject matter experts. We ran an open call for tools that integrated climate and health data. We managed a rigorous peer review process where submissions to the open call were assessed against this new maturity model. And all of this was supported and endorsed by leading global organizations. Maturity models for global goods have been curated by Digital Square at Path since 2017 on behalf of the global health community. These models are periodically updated to reflect the evolving digital health landscape, as well as the growing complexity of global needs. The latest iteration, known as the Maturity Model for Climate and Health, introduces new indicators specifically designed to assess open source digital tools that produce or use or integrate climate and health data. It serves as a practical reference for anyone interested in understanding internationally recognized criteria for assessing digital tools in this emerging space. The framework can also serve as a benchmark for future tool development. Development of the climate health maturity model was informed by broad community input. Feedback was gathered through targeted workshops with global, regional, and local communities of practice. The model includes 6 core indicators: the 3 existing indicators, global utility, community support, and maturity of the tool itself, and then 3 new core indicators: equity and inclusive design, support for climate resilient health systems, and contribution to low carbon digital health systems. These indicators are further broken down into a total of 35 sub-indicators, covering areas such as the tool's multilingual capabilities, the availability of user or technical documentation, data privacy and security, interoperability and standards alignments, and much more. The resulting model provides a consistent assessment framework for comparing tools using globally recognized criteria. It therefore supports evidence-based decisions for funders, implementers, and governments, and it also encourages continuous improvement by highlighting areas for growth and development. In summary, the maturity model helps to raise visibility for emerging digital public goods and ensures that they are not only technically sound, but also scalable, interoperable, climate relevant, and ultimately impactful for the communities that they serve. In March 2025, Path launched an open call for digital health tools. We were looking for software applications, digital content, or services that bring together climate, weather, and health data, tools that can help countries with climate adaptation, mitigation, and planning to protect people's health. The call was widely publicized to climate and digital health experts and communities of practice. Developers and implementing organizations were invited to apply. Each application included details on the tool's functionality, governance, community support, and implementation footprint. Also described how they align with global standards, such as ICD 11 or HL7 Fire. And it included a self-assessment of the tool's maturity levels across different areas using the new maturity model for climate and health. Let's walk quickly through the minimum requirements for a tool to be considered a global good for climate and health. First, the software must be available under an open license, for example, an OSI approved license. That ensures transparency and accessibility. Second, the tool needs to show clear relevance to advancing the Sustainable Development Goals, or SDGs, specifically SDG 3 for health and SDG 13 for climate action. And finally, the tool must also meet the requirements of the Digital Public Goods Standard. Global goods are a subset of digital public goods. What makes them distinct is their focus on just two SDGs, health and climate, and the fact that they are also assessed for maturity. The peer review group for this project is made up of independent experts with a strong balance across climate and health expertise, different geographies, gender, and experience in both technical, policy, as well as implementation experience. The peer review process is designed to be rigorous and transparent, and its purpose is to ensure that digital tools put forward for global good designation are assessed fairly, drawing on both technical and programmatic knowledge, as well as real-world context. The peer review group is responsible for defining and refining categories for the maturity model, evaluating eligible submissions against the maturity model, and then making recommendations as to which tools should be designated as global goods. These recommendations then go to the Global Goods Review Board, a technical oversight body for the Guidebook. The board makes a final decision on whether a tool meets the thresholds for designation. All applicants receive constructive feedback, highlighting strengths and also suggesting areas for further development. Finally, PATH publishes the approved global goods in the Guidebook, recognizing them as digital public goods that meet rigorous global standards. The Guidebook is available in two formats. The Guidebook, Climate Services for Health Annex, which is available as a downloadable and printable PDF, and also as an interactive website that you can find at globalgoodsguidebook.org. The website brings together all of the existing health global goods and now also includes a new dedicated section on climate and health. This is where you'll find information about the newly approved global goods. First one is DHIS2, and many of you already know this tool. It's the most widely used open source health information system globally, with adoption in more than 75 countries at national scale. What's new is that DHIS2 now includes climate apps and modeling tools. This means countries can integrate rainfall, temperature, and environmental data directly alongside health data. And the result? Ministries of health can forecast outbreaks of climate-sensitive diseases like malaria or dengue, and better plan interventions such as vector control, vaccination campaigns, or public health messaging. The second new global good is EWAS-CSD, the Early Warning, Alert and Response System for Climate-Sensitive Diseases. This has been developed by WHO and TDR, and this tool empowers frontline health workers and district managers to predict disease outbreaks in real time. It uses machine learning models that combines historical disease data with climate indicators such as rainfall, humidity, and temperature. Already deployed in 19 countries, EWAS-CSD has been shown to trigger faster, more targeted outbreak responses, helping save both lives and resources. The third global good for climate and health is GeoPrism Registry. This is a geospatial data platform that acts as a single source of truth for geographic data. So that's things like administrative boundaries, health facility locations, and climate zones. By standardizing and sharing geographic data across ministries and agencies, GeoPrism makes it easier to link climate and health information. And the impact here is on service delivery. Governments can plan resource allocations, target interventions to specific areas, and ensure that climate risks are factored into public health planning. The Annex also highlights promising innovations that, whilst they don't yet meet the criteria to be a global good, are still gaining maturity, but show great potential. The first is ClimeWeb, which is helping national meteorological services deliver climate information to decision makers. Then there are flood risk analysis platforms for disaster preparedness. There are also interoperability solutions like SpeedyMesh and the OpenHIM with its new climate mediator. And there are various standards-based implementation tools that use the standard Common Alerting Protocol, or CAP. Things like the Google Public Alerts freeware and emergency management freeware. There is also a suite of R-based tools developed by the Global Health Resilience Group at Barcelona Supercomputing Center. Designed to streamline climate-informed disease risk modeling and forecasting, and developed as part of the Harmonize and ID Extremes projects, these tools support analyses across a wide range of health outcomes and climate-related exposures, whilst also accounting for underlying demographic and socioeconomic inequalities. So all of these emerging innovations show where this field is heading and how digital infrastructure is evolving rapidly to meet climate health challenges. Now let's talk about how this annex can actually make a difference in practice. On the website, for example, you can search for digital tools by type of system, such as DPI or system classification, health or interoperability standards that they support, and you can also explore maps that show where these tools have been implemented. The guidebook, both the website and the PDF document, can be used by ministries of health. It's a catalogue of vetted tools that can be adopted and adapted, helping countries to avoid reinventing the wheel. It can also be used by implementers and NGOs, where it provides tested solutions that can be integrated into existing health programs, improving effectiveness and efficiency. And for donors and funders, it highlights scalable investments with proven impact, ensuring that resources go to tools that are open source, interoperable, and sustainable. And lastly, for technologists and researchers, it offers technical documentation, access to demo sites, and to communities of practice to collaborate and innovate further. The ultimate impact is this: health systems that can predict, prepare for, and respond to climate-related health risks more effectively, protecting vulnerable populations and strengthening resilience at every level, from communities up to national systems. In closing, the Global Goods Guidebook, Climate Services for Health Annex, is more than just a catalogue of tools. It's a roadmap for action at the intersection of climate and health. It's the first of what we hope to be additional resource compendiums to enable and unlock investment into resilient health systems. To learn more, you can visit globalgoodsguidebook.org to explore detailed tool descriptions, demos and resources, and download the annex. You can also explore climahealth.info, a joint WHO-WMO platform that has case studies and a resource library. And most importantly, consider how your own programs, policies, or investments can adopt or support these global goods. You can also contact Heidi Good, Project Lead, for more information. Thank you for listening.